Hello dear doctors, nurses, med student and healthcare team. How are you today? I hope you are well. Here we are going to talk about another question of cardiology. A 55-year-old man was brought to the emergency department from shopping mall after collapsing 2 hours ago. He is now fully conscious and answering questions. His ECG shows an irregular rhythm. His blood pressure is 120 on 80 mm Hg. What is the single most appropriate investigation to carry out? Okay, A. CT, B. MRI, C. 24 hours ECG, D. Echocardiogram, E. Exercise testing. And the answer is echocardiogram. The patient's ECG, the patient has already ECG, is showing an irregular rhythm, and the patient's is hemodynamically stable. His blood pressure is 120 on 80 mm Hg, and the single most appropriate investigation is echocardiogram. Here we are going to explain the question. Echocardiogram would be the best option here. It is used to identify structural cardiac abnormalities and assess left ventricular function. It may show a clot in the atrial appendage responsible for syncope, which would be due to a transient ischemic attack secondary to atrial fibrillation. The most common valvular cause for a syncope is aortic stenosis, which needs a echocardiogram to diagnose it. Okay? The most common valvular cause for a syncope is aortic stenosis, which needs an echocardiogram to diagnose. A Holter ECG or 24-hour ECG is not needed if the ECG is already said to have an irregular rhythm. If they did not state that the rhythm was irregular, then 24 ECG would be a good option. Okay, CT and MRI may be performed in selected cases like aortic dissection and hematoma or pulmonary embolism, cardiac masses, pericardial and myocardial disease, congenital anomalies or coronary arteries. However, as he has recovered fully, it's unlikely to be any of the causes requiring a CT or MRI. Exercise testing is for patients who have experienced episodes of syncope during or shortly after exertions. But if there was no mention of exertion in this question, we don't need exercise testing for the patient. This was a short explanation about the patients coming with a syncope, and his ECG was showing irregular rhythm. We explained a little more about syncope and the patients which are coming with irregular rhythm in other questions in our YouTube videos. You can watch for more information about these situations. Thank you for your attention.